Good girls, that's it.
For survivors of sexual assault, the fight to be believed can feel like an impossible task. For Sarah, it happened while at her lowest, in a hospital meant to help her after years of abuse.
This member of staff was walking behind me down the stairs, and as I was in front of him, he groped me.
Were you believed?
I don't think so. That individual member of staff the next evening was put on my one-to-ones.
How did that make you feel?
Powerless, scared, and quite hostile.
Sarah now works in mental health for the NHS. Sarah is not her real name, and we're protecting her identity.
It's very broken. There's no money. All the teams are in crisis. Your community teams are in crisis. People who are extremely ill are waiting 2, 3, 4+ weeks to get a bed, and even then they may go out of city.
The NHS Trust that employs Sarah said, "We take all concerns from our staff about training and sexual safety very seriously, and we strongly encourage this individual to come forward and tell us their story. Any allegations of sexual safety are reviewed within 4 hours and addressed by convening a safeguarding meeting. Our guiding principle is to believe any sexual safety reports from staff and service users. We report incidents to the police whilst ensuring appropriate internal safeguarding measures are in place immediately."
I was naive to think that what we did would put a stop to these things.
Kathy has faced the same fight. She worked as an NHS nurse for over 40 years. Alongside dozens of other women, she fought for an inquiry into psychiatrists William Kerr and Michael Haslam, who were convicted of sexual abuse. It found alleged victims like Kathy had not been believed. 20 years on, she says mental health patients are still not trusted.
Staff need to know that just because someone has a mental health problem doesn't make them a liar. People need to understand that, yes, they've got a mental health problem, but that is just a condition, the same as they've got, an appendicitis or whatever else, It's no different as far as I'm concerned.
77% of mental health services with adult acute wards or ICUs are rated as requiring improvement or inadequate for safety. Since 2016, there has been an increase of 24% in the number of people in mental health hospitals. But at the same time, the number of mental health beds is now at its lowest level since records began. And that, according to a senior psychiatrist, is leading to patients on mixed wards being at risk.
You cannot separate the sexes again into different wards when the beds you already have aren't sufficient. Even in mixed wards, you'd have to create new wards and have more beds, which is desperately needed. That's not going to happen unless there's a complete, total overhaul of mental health services.
NHS England told Sky News that any form of abuse or sexual violence is completely unacceptable and said that it was rolling out better reporting mechanisms, training and support as part of the NHS's new Sexual Safety Charter. And it's hoped then that patients like Sarah and Kathy get the protection they deserve and be listened to when they don't. Ashish Joshi, Sky News.